This is your host, Dr. Aftab with the program Innovative Pakistan with Dr. Aftab. So, in our earlier program, we were discussing about emerging trends in digital media, and now what we are going to discuss is a totally different thing, that is pandemic preparedness in the era of climate change. So, both the topics are very, very important. We are having a worse kind of climate change condition, and Pakistan is a country, is among the top 10 country who is suffering from this climate change. If we talk about anything like our agriculture system, our health system, that is suffering from this climate change. On the other side, there are so many pandemic, and recently we have just passed through the corona epidemic, and that has halted the whole world. And there are so many other things which are very much coming up in the future, and even right these days. So this is what we are going to discuss today, and with us is Dr. Saira Karimi, who is an expert of public health, and she has a lot of experience, so we'll definitely learn from her what organization she is working and what role she is playing. But she is an expert. She has done a lot of things in area of pandemic preparedness, in area of biosafety and biosecurity, and also in area of One Health. So One Health is a very much into the market, the new concept in which we actually talk about the human health and environmental health, and also the health of the animals in a single way, like all the things we together, because our human health is definitely directly linked with the environmental health and also linked with the health of the animals. So this is what we are going to discuss today. So we start our program with our we would like to know a bit more about Dr. Saira Karimi. We will definitely, from our previous guests, we asked them to start with the university education, but I'll definitely ask Dr. Saira to start from her primary education. So tell us your journey, like how you have achieved your PhD starting from your primary education, and then definitely we'll discuss her professional responsibilities, and then we'll move to the main topic.
Thank you so much, Dr. Aftab. Thank you for having me here today. It's my first time in FM radio, and it's first of all I would like to congratulate you that you have initiated such a great platform where us researchers or scientists, public community, the gap between us and the public community is somehow being narrowed down. So congratulations for initiating such a great program.
Thank you.
Yes, I would start by that my primary education is not from some fancy school. I have started my journey, I would say that, from a very small village in the South Punjab. I'm from Rawalpindi. I have grown over there, and up till my intermediate.
Right.
My education is all from the government schools. Yes, first 5 years, that till fifth, I was in an English medium school. Where not the English medium school we are having today. It was just the English medium school, but
the name was English medium. But
yeah, it was it was just a model public school.
Okay.
I am truly obliged to all of my teachers.
Right.
Whatever I am today, and God, Allah has made me what I am here today. But my parents are at the same time my teachers. So I was blessed. Had some great teachers, mentors in a very early stage. Was a hardworking student. So started off from there. Was a pre-med, but my father was a dental surgeon. He decided that I should not be opted for the medical education because MBBS one. Because other family members, they are all medical doctors.
Okay.
So he asked me to choose this path of being a PhD doctor.
Okay.
So
Nice.
a vision was already there, and I remember that I used to have, my mother also tells me this story, that I used to have a register with me, and there was a photo of Kadazim University over it. And I used to say that I'm going to go and study over there, and there was no plan. So in 2004, my eldest brother, he came over here, and then from Rajanpur to Bhutan, from Haldun Zakir University, I've done my BSc,
Okay.
and my master's and my MPhil is from Qaeda University.
Nice.
So once I was here in
Dream come
summer,
true.
yeah,
Okay.
it was strong manifestation. So it was great manifestation. So my master's and MPhil is from Carcassonne University, and my PhD is from ComSats. Half part of that was done in France, University of Montpellier. I
Nice.
went over there, and we were working on a project. So I would say that it was all the blessing of my parents and my family, and you just keep hard work, and then the gates are open for you. So in during PhD, I have discovered a lot of things about my personality. I used to be a very shy student, but I would say that in concepts it literally explored some very hidden areas. So there, my mentor, Dr. Zapta Khan Shinwari, I would like to mention him, Dr. Amir Ikram, and Dr.
Great
Anwar Naseem.
scientist, yeah.
So these, I had the privilege of working with them at such a young
eminent-
age.
yeah,
So
definitely.
voluntarily, I developed my interest in bioethics. That time, very new, term, the buzzword,
Right.
and I was literally very enthusiastic of working over there. So we volunteered a project. It was all about biosafety and biosecurity. From there, I developed a love for the public health. Actually knew what the threats are and what could be, what can go wrong when we are not familiar with certain SOPs. So with a lot of working and training, and I associated myself with Pakistan Biological Safety Association, and I was earlier trainee over there, and now I am proudly serving as co-chapter head PEPSA, ICT chapter, with Dr. Saeed Khan, and all the blessings from there. So after PhD, I joined Bahria as the visiting faculty member, public health department. There I was again, teaching epidemiology, supervising the projects that are on the vector-borne disease. So I was always, very much interested in linking things. My PhD project was also, I was working closely with the organization, which is Snow Leopard Foundation. I was a field consultant over there. So it was an international project, and there, for the first time, the project that I worked was on the multi-site experimentation. We actually induced the climate warming, and we started from the primary producers on the plants, medicinal plants, and it was the site on Gujarat National Park. So during PhD, it was really a great adventure for me because I am a great traveler too. I love to travel.
Excellent.
And each year I used to go over there, spend 2-3 months in the Gujarat National Park in totally no electricity, no mobile era, just science.
Wow.
And so there was my PhD was on that I developed some strategies how we can predict the climate change impacts on medicinal plants, what are their adaptations, what are their vulnerability, and my teammate, they were working the same thing but on the animal ecology. Then we took that project and we enhanced it in terms of pollen allergies. That how climate change is affecting the seasonal variation are affecting those plants who are causing the allergies in human, and their onset, their blooming period, because the summer has been extended due to this climate warming, increasing temperature. Though we are having increasing temperature, and then there are a lot of the duration of the summer has increased. We don't really have autumn and spring these days, and in these years we do not know. It's just the onset of summer, and then there is winter, and then it's so abrupt and fluctuation in the temperature. So coming back to that thing, we won a project from HEC. It was on pollen allergies. So there I worked in ComSat as a research associate over there. And after that, taking my interest into it, when I served serving as an assistant professor in Rawalpindi Medical University in the pathology department, the dengue department was of my interest. And then I had the privilege, because of Dr. Muhammad Umar, our vice chancellor, he gave me all the authorities that this is your data and you have to work. And again, the One Health and the interest and the enthusiasm, we developed a project on that how can we do the vector-borne disease surveillance in the era of climate change. So this is all about my interest and everything, because I'm training some individuals, from the platform of PEPSA, that we really wanted to prepare our young generation, our young researchers, to the upcoming pandemic, that how can we survive that if we have one now. Because now we are having an additional threat, which is climate change, and that cannot be neglected.
Definitely. So it's not only the problem in Pakistan. I think so many countries are suffering from this threat. We know that in so many other, like in European countries, there were no mosquitoes before. Even there were stories of New York that there are no mosquitoes, and now there are big mosquitoes there, and they are suffering from so many like mosquito-borne disease. So it's like not only in the Pakistan, but this is also a greater global problem. So there is a definitely need of global efforts that how we can prepare ourselves to mitigate all this situation. So one of the things like I would really like to know is, during my PhD I was working in Pakistan, and then for some of my research project I went to US, and I was working there, and there was a totally a different atmosphere, not only for like cultural differences as well as the research infrastructure. Especially I would like to talk about the research infrastructure there. So the things we were doing in Pakistan, if we are doing like in a year, we can do there in a week. So the things were very fast there, and that's really fascinated me. And we came back and started the National Academy of Young Scientists in Pakistan, so we can do something for our young researchers. So you had like the opportunities to spend some time in France. So what kind of research infrastructure difference you found in Pakistan and France? Not only the research infrastructure, but also the mindset of the researchers. So what like differences you could feel there, and what you learned there, do you implement it coming back to Pakistan?
Yeah, definitely. When you go over there from Pakistan, one thing that I would like to start from, there is no big difference in the intellect. Intellect is the same,
Right.
and it's a great, we are blessed that we are being grilled over here so much that we can easily cope up with any kind of situation over there.
Right.
But obviously, providing the opportunities. Talking about the opportunities, yes, I would like to tell you that after 3 years, I went to France when I started my PhD, and in just 6 months, I was done with my publication. So here you can imagine that in terms of infrastructure, they're advanced. I was not I didn't have an experience of working in the lab. I was actually developing my soft skills.
Okay.
So I learned our language over there, because I can say that today in this era too, we are working on some softwares which are really outdated, and they are not very applicable in that world. So I had to learn that coding language. So me as a bioscientist PhD, and I'm learning 3 months. I was like not learning. I learned it from YouTube, and then after that, it opened many doors for me. So it was not very difficult, but yes, and also the opportunities over there. There are a lot of when you have a problem, there is already a solution established over there. Here, there are solutions too, but we really need to dig ourselves for that. And international community is also so much linked together.
Definitely.
In Pakistan, that is lacking. If you are working on something, on a project, and you want somebody who is having a soft skill better for that, over there they will acquire it. But over here, it's the interconnectedness is somewhere missing over here. Over there, and what have I implemented? I started training on R programming and data interpretation and research, because over there I learned that the way I was seeing the things, I had to broaden my horizon for that. And luckily, I would say that I had some great mentors. So they were there to help, and they're still in my contact.
Okay.
So it's
Excellent.
great. And also, my PhD is from Comstate University, and my international supervisor, he's an external reviewer for the thing. So I built some connections. And also, there was a student from Senegal. She was doing PhD. Now she's an international reviewer in our journal, Rawalpindi Medical University. Because I am also serving as an assistant editor of
Okay.
Journal of Rawalpindi Medical University, and some student journals too. So I actually built that thing, because when you do that, you actually increase the reach of your papers, because and you have some incredible studies over here. If talking about some medical sciences and medical studies every day, hospital data, there's so much data. And one thing that I learned was data analysis.
That's actually very important, because today, you know, it's being said that data has the more value than
Yeah.
anything now. So data is very important, and you have worked on the data, especially analyzing that data
Yeah.
and gaining the important information from that. So we like lot of discussion is going on now on the concept. I just mentioned like what I know about the One Health. So can you please elaborate a bit what is the One Health concept with some examples so we can like better understand
Yeah.
about the One Health?
Yes, so initially, the understanding of people before pandemic, I'm saying that, we actually was, our concern was to look after the patient. That's it. We never very much concerned about what vector is causing that and how the environment is affecting it. After pandemic, I think people and also researchers and scientists, the public health in Pakistan, I'm telling specifically in Pakistan, we developed many of the public health laboratories too. And why? Because when we went through what we went through during this pandemic, we actually learned that how the transmission can, cause something, the understanding and the awareness, because there are a lot of trainings. So when we talk about One Health, that concept actually emerged. There was that, but the hype about that concept emerged after the pandemic, because we really wanted to, because we got the understanding of that how things can go wrong at what level. So talking about, if I can exemplify, in 2022 we had some severe flooding in Pakistan, and then there were local outbreaks of dengue, malaria, mosquito-borne diseases. So now when we talk about malaria is kind of a disease which has a vector which is mosquito. And now if we want to link it, because if the flooding provides a great breeding site for that mosquito,
Right.
and also the warmer temperatures, because we are having the warmer temperatures. So if we talk about climate change, we have warmer temperatures, we have very abrupt pattern of rainfalls, and the flooding. So these three things, they are providing the excellent breeding site for the mosquitoes, thus the spreading. And we are having again with the dengue too, because every year we are in late September to October to November, we are having gush of dengue patients. Our dengue ward at Holy Family Hospital is flushed with the patients, and it's this the transmission rate. We have to understand that because of these changing climate and things, the transmissibility of the disease is also changing. Like I mentioned about pollen allergies, because if you were exposed to a certain kind of, for example, the paper mulberry, which is in Islamabad, causing many of the pollen allergies, and there is a flowering season for that. And if we extend that flowering season is extend, that means the exposure is extend, and it's because of the warmer temperature which is caused by climate change. So that's what the link is. And second thing, chikungunya and dengue, they are both the vector-borne diseases. And now, right now, we do have some climate models. We are working closely with Pakistan Meteorological Department. They have developed some climate models. We can interlink and predict that thing, that how can we, the surveillance of the vector is very important now, because there we can stop it from spreading.
Definitely. So what do you think, what areas of, like you have traveled almost across the country, and definitely your colleagues are working almost everywhere in Pakistan. What do you think, what areas of Pakistan especially, we are like more vulnerable to this climate change, and how we can like prepare those areas?
So it
Very
was,
much.
so it was really alarming for me when we say that I have worked in Hindu Kush and Karakoram Himalaya region. It is HKH region. It is considered as a third pole of the world, and it is melting. Like glaciers have disappeared, because my study included some surveys from approximately 20 villages down the elevation gradient, starting from Punjab National Park to the Gilgit.
Right.
So we had this opportunity of talking to people, getting their indigenous knowledge, and they have told me some very scary stories as well. One thing, glacier melting is there, And because when mountainous communities are already very fragile and sensitive, whatever is happening over here is felt there before. So those, and also underprivileged area from where they are, South Punjab, because when the flood is there and the outskirts of Rajanpur, Rujhan, and in outskirts of Multan, this Punjab area, because it's underdeveloped and there are a lot of agricultural sites over there. So when there is a flooding and there is not the reach of the hospitals is not possible over there. So there was small outbreaks over there as well for malaria, even typhoid. When we talk about these things, they're emerging of many diseases. The contributing factors are there as well. Typhoid has become very endemic in 2022 over there in those areas too. So it's plain areas. Nothing in the safe is safe.
Right.
When we talk about Islamabad as well, if I share my personal experience when I came over here in 2010, everything was really, really changed. The environment, the climate, the weather was so pleasant. The degrees, the centigrade, the temperature never crossed 40 in Islamabad, and the intensity of the heat that we just have felt in summers, it's shocking.
That's true.
For me. So these, I think, vulnerable are those areas where there are not the facilities to, because urban environments are more vulnerable, because more the population like Lahore, more the population is there, the breeding site of the mosquitoes are there, and more people are exposed to such diseases.
So right now in Pakistan, what do you think? We are talking about the pandemic. So if we talk about mosquito-borne diseases, so we are having malaria cases are there since centuries, and now we have another problem of dengue. So what do you think? Which is more now problematic for us in Pakistan? Is it malaria, which is more prevalent, or is dengue, and how we can overcome these problems?
The vector-borne diseases and the agent that is causing it. The problem is because of this. We need to understand, because of this warmer temperatures, these strains of viral or bacterial diseases, they are actually mutating very fast. We do have serotypes of the various dengue virus in us. So there are 4 serotypes too, and there why we are having again and again having these things, because these strains are mutating high. We do not have, and one of the main problem is that we do not have any molecular assay or kits developed which are native for the Pakistani population. You understand? Whatever we are using for the diagnosis of these all, they are from imported from some foreign country. So we need to develop that, and we are working closely with National University to develop some kind of molecular assay for the rapid detection of dengue.
Right.
That's another thing. So if we have to prioritize, because the dengue area, the dengue season is very short, but
Okay.
it's very hyped. The number of the patients are almost they crossed. And
Okay.
we do not have, yes, dengue fever is, if it's correctly diagnosed and timely diagnosed, it is the things, the treatment is available. But if it's not, it can lead to the shock syndrome, and where the internal bleeding is started. So effectively timely. Malaria is there, endemic over here.
Okay.
So again, if I say that more resistant to it, because our population has not been recovered from malaria, it's been there from, and dengue hype has just started. Not just started, but it's quite new as compared to malaria. So I would say that new emerging diseases are more very much concerning for us, because we do not have developed the immunity against them, and they are evolving rapidly due to this climate change.
Okay. So there is also discussion about the chikungunya. So what is chikungunya, and what is the causative
It's
event?
again the vector-borne disease,
Mhm.
and it's some the urban area environment. It's also a mosquito-borne disease like dengue, and the symptoms are very much similar to that thing. The causative agent is also the virus, and also that is causing deaths specifically in the urban areas too. So same surveillance patterns are there, because I told you that when we start the diagnosis of that, it's very necessary to diagnose, but is happening over there,
Okay.
how the patient what patient is suffering from.
Right.
Somehow there are a lot of patients that got admitted in the dengue ward and they're not actually having the dengue fever. So at the that admission rate and that thing, and they unintentionally they get exposed to that. Because they got admitted, and there are a lot of things that we need to understand over this. Chikungunya is also there. It's the season also starts from here, like after monsoon, mainly in monsoon area, monsoon season. We do have these two threats, and in flooding we do have malaria.
So what we have seen in Pakistan, we also observed some cases of Congo virus.
Yeah.
They were also reported in Pakistan. So how big is that threat? And do you think are there like the vectors available in Pakistan, and can it spread?
Yeah, it's tick-borne disease actually. So normally when we do have Eid al-Adha, and that's the sacrificial, our religious commitment to that thing, and we did have a very good training workshop from the platform of FEPSA, where we have actually talked about this thing, that what SOPs, what hygienic conditions should be monitored using that thing, because starting from choosing the animal to sacrifice, and then going, because it's the tick-borne disease and ticks can get to you if you don't opt the proper hygienic conditions for that thing. So that is the animal-borne disease, and we have seen that the prediction of that thing is that the new pandemic that would emerge, that would be a zoonotic disease. So we are actually every year we are having that thing, because the dumpsters are not that much developed in Pakistan too. There is like the ticks are available, or you have seen what can go wrong with all of these the remains of the animals that we have after the sacrificial things. So that is an alarming concept, and after Eid al-Adha mainly we actually run an awareness campaign too, where we actually want to train those individuals, the butchers and everybody, that how to properly eliminate that risk, which is become very dangerous for you after some time. So that is also there, because it's animal-borne disease and it is a zoonotic disease. It can transfer to you, and you can transfer it to your loved ones and your family.
So another actually very important question, and this is like in most of the discussion. So what happens in most of the developed countries? So if there is like any zoonotic disease or any other disease which is coming into those communities, then there is a very good response, and after a few years we have seen, like if there are 100,000 cases, then after 5 years there will be maybe 10 or 20 or 100 cases of those diseases. So what we have observed for the last 15 years, and this is like my own observation, in most of the African countries, especially the Central African countries and the country like Pakistan, in the developing world.
Yeah.
So what happens, just like there were cases of dengue, we know for the last 10 years the data is coming. So if it is in any other country, the response could be the cases should be reduced. Like if it is 100,000, then next year it should be 50,000, and next year because we know the causative agent, we know the vector, and then we can close the breeding sites and so on, so we can reduce the number. So this is not happening actually. Last year there was a hype of dengue, there were so many cases, and then we were praying that God help us lower the temperature so there shouldn't be no more mosquitoes and we can end this problem. And same is true now. Once again we are praying. So what do you think where we are actually lacking? What kind of response we should have in Pakistan so we can really bring the solution, so we can overcome these, the preparedness that we are talking about? How should we prepare so we can reduce the cases of just like another thing we are talking Pakistan, wherever you go, if you are a virologist or if you are a life scientist, everybody says that the world has overcome the polio problem, but it's still there in just two countries, Pakistan and Afghanistan. So you haven't overcome this problem. So where we are lacking in this preparedness?
Okay, so yes, there are some things that are lacking on so many levels. I would start from individualistic approach. Change starts within.
Okay.
So unfortunately, our public, when there is a hype, when there is you are at the risk of a death, then you start actually doing something about it. And unfortunately, due to, like, in spite of having a lot of training workshops, awareness campaigns about polio, AIDS, we are talking about a lot of these campaigns. There are a lot of NGOs that are working. What is not going wrong? What is going wrong and what's not implementing? I think individualistic willingness to do that, to bring the change, and also the policies are there. One thing that I have observed is that when we make a project, it's a really good project. We start it and it's at high.
Okay.
But the correct surveillance of the implementation of that project is not there. Surveillance, we're lacking in the surveillance, because if you know that every year dengue is coming, this is the thing. So start preparing for it. We know every year flooding is there, flood is coming. But what implementation strategies are there, but implementation is also at somehow, but the surveillance is not there. Nobody is taking that stick, and unfortunately we need that. So that we are not lagging behind in making policies. We are not lagging behind in somehow there are some lack of facilities in those underprivileged areas too. Many things are not provincial levels. And when we talk about provincial level, I'm not talking about one provincial and one city. I hope you understand what I'm talking about. I'm talking about the provincial level and the underdeveloped cities of that. I'm talking about basically Rajanpur and these all. So I think that policies are there, somehow funding is also there, but one thing that is lacking is individualistic willingness, and second, the surveillance of implementation of those strategies. Because implementation is there somehow, but surveillance is not.
So how we can prepare the mind of our people? How we can change that? That's it's a very difficult thing to do that. But what do you think? How we can bring the change into the mind of the people that they should start acting?
That's a very good question, and I think media. We do have, every individual, they do have a mobile phone, and I think Pakistan has started a very good thing, that ringtones. Wherever there is flooding, rains, or any kind of epidemic danger or any kind of outbreak, there is also a ringtone available to you. So that is one, the message is there. Also, training people, talking to them, going to the reach of those, because there are many areas in Pakistan too where there is no reach of any media. So how can you go over there? So that is many projects are there, the NGOs are working to, but you have to go over there and you have to give them some insight about it in their own language. Train them, not training them, but just tell them and provide them the facilities.
Okay. So many of the things actually which are translated into society and the projects which are going on, they are coming from the university, just like you are working in a medical university right now. So what role the universities can play in all those sectors, like preparing the mind of the people on one side, bringing the innovation on the other side, and bringing the real change in the society?
So, like you said, these three things should not be a three, individual things. They should be interconnected.
Right.
Okay. I feel, as a researcher, my all education is from Pakistan. I felt there is a huge void between university and the government policies. We need a place on the table where we can put the young generation, the young researchers like you. We really want you, that you should be in the policy implementation, policy making of what Pakistan is actually going to face in the near future. So when we talk about innovation, it's just in the university level. The reach between the industry and government is now started, that we are going the projects that there should be some industrial application, there should be something, you should be having some product on the table. Now it has started, but when we do not have a particular reach to the university or the government policy, the government sector, which is actually going to do what is going to happen over here, which is actually going to receive the fund. We really want to have the young researchers and the scientists. We really need to have a place on the table so that we can actually give our opinions to that, because knowledge is updating every year. We need fresh minds.
Okay, so you also mentioned that you are working in PEPSA and you are the chapter head in Islamabad. So what role PEPSA is playing in Pakistan for like the preparedness, for the awareness of the people and training of the the relevant people, just like you have mentioned that we are providing like training to all those like organizations, universities, hospitals and other sectors. So could you please highlight a bit?
Yeah, Pakistan Biological Safety Association, it was started with some great minds. I would like to mention Dr. Arman Naseem, Dr. Zafar Kanshanwari, Dr. Amir Akram, Dr. Shamsul Arifin. So they have started keeping in mind all the threats, bio-risk assessment, the risk, when they started this organization in from a room, and now Dr. Saeed Khan, which is serving as president of PEPSA. So they have a lot of, they have obligations towards this nation. So they started this. Pakistan Biological Safety Association is an association which actually gives trainings, workshops, fellowships. They train the individuals about the biosafety, biosecurity, and biorisk management issues. And there are some master trainer training workshops that train up the trainers. We do have international trainers, and they come and then they train us that how can we prepare ourselves for any kind of pandemic, any kind of emergency outbreak, any kind of emergency that is going to be there, in public health scenario. And also recently we do have, in terms of cybersecurity. Now that you have talked about the data privacy and then cybersecurity in the world of AI, it has become a new buzzword for that thing. So whatever the human health risks are there, we are there to cope with it, and we really provide the trainings from the platform of PEPSA. We do have office in Google Green, and also there are a lot of all the provinces. They do have one chapter head and two co-chapter heads. But in ICT, I am the co-chapter head. Dr. Finish is chapter head, and each month we do make sure that each university researchers, newly appointed researchers that have started working in medical laboratories, in microbiology, in any kind of genomic laboratory, we should train them that what their academic integrity is, what their biological ethics are, and what are they exposed to, because these are young researchers. They do not know that what possible threat they are dealing with. Talking about any viral or bacterial disease, so they do not know about it. Talking about again the plant tissue culture, so that thing we give trainings to young individuals and also to the industrials too, where the products are being made. So we do have an occupational health safety program too, where we train individuals so that they can implement these all steps that are required for the betterment of vaccine preparation, antibiotic development, microbiology lab, biology labs. So these all they get training from us, from the platform of PEPSA, and then they implement it in their own institutes. So this is how a network of awareness campaign is going through, and it's from the platform of PEPSA.
That's really a great job PEPSA is doing. So like preparing the people and training them, and you have just talked about the cybersecurity. I have recently seen all those workshops that are being conducted at PEPSA. So that's really. So at the end, I would just like to briefly ask you that how much we are prepared in Pakistan, because if you compare it, we can't compare it with the very advanced countries, because we have seen recently what outbreaks were there and their response and our response. So how much we are prepared? Like normally, what I observed that we have to get help from other countries, even for the diagnoses and many other. So how much preparedness is required in the future that we can really overcome these issues?
How much we are prepared is that we now know that what risk we are facing, we are going to face. We can predict that risk before, and I'm really glad that there are a lot of emergency responsive organizations that have developed, like NDMA, and PMD is also getting their projects, and they know that climate change, temperature is not a separate entity. We have to collaborate with it. So we do have the awareness, but again, I would say that we are lacking in the implementation policies, and for that implementation to be done, we need some kind of funding resources, and we're lacking on the fundings too. Because when there are facilities, when there are I would like to quote one example in public health. In pandemic era, there were some mobile, laboratories that were over there. But that could be happening right now too. Mobile apps, alerts, If you are having any kind of outbreak somewhere, you should be having some kind of alerts on your mobile, so this surveillance system, again I will talk about this surveillance system, that we really need to work on our surveillance implementation and then the surveillance.
So, like, I know that NEH is working very closely for the surveillance. So, how much, what kind of data we are getting? Is it enough? And what, like, more effort we should do?
Yeah, I would say that we really need to enter into the digital healthcare system now. Everything that we say that electronic healthcare system, that is the main thing, because I would say that interconnectedness is lacking.
Okay.
So NIH is just one. We need a lot of more such organizations.
So actually, I think we need more time to discuss. There are so many other important topics, just like infection prevention and control in the hospital setting, both in the government sector and in the private sectors. And one innovation is needed there, and what kind of sport is there, what PEPSA can do, and many other organizations can play a role in that. So time is very short to actually sign off from the program. At the end, I would like Dr. Saira to please share her message for our youngsters, that especially like how we can. She has mentioned that where we are lacking. So, but what message you would like to give to our listeners about the specific topic of pandemic and pandemic preparedness and climate change, and how we can overcome and what we should do, all the community.
As an individual, and my message to the youngsters, they are very enthusiastic. This generation Z is very enthusiastic. They have a lot of capabilities. So I would just say that understand your role as a responsible citizen, and the responsible conduct of science is very important. And you have to understand that no one is safe until everyone is. So just realize your own responsibility. Be honest to the role that you are doing, and be honest to your country as well.
Very nice. So at the end, I'm very much thankful to Dr. Saira. She could spare time and she joined us in the studio, and we had a discussion about a very important topic, that was the pandemic preparedness in light of climate change. Climate change is a reality. Temperature is rising, and health is suffering, agriculture is suffering, many other organizations are suffering. So we definitely have to prepare, and for the preparedness we need the expert, just like Dr. Saira was here today, so we could know that where we are lacking, what step we should take to prepare our young generation, and at the policy level that's also very important. She rightly mentioned that there is a need to implement. All the policies are there in Pakistan, but there is need of implementation. And for the implementation, definitely there is a need of more awareness in the public, so they can really join hands with the policymakers, so we can overcome the problem we are facing. So with this, thank you once again, Dr. Saira, for joining us today, and hopefully we'll request you for some other programs as well.
Always be a pleasure for me. Thank you for having me today.
Thank you.